Hello friends, let's see the superficial palmar arch. The superficial palmar arch, as the name suggests, it is an arterial arcade or arch formed by the superficially situated area in the palm. So the name is superficial palmar arch. The superficial palmar arch, it is actually situated just deep to the palmar aponeurosis and in front of the deep flexor tendons and the lumbricals which are present in the palm. So when we see the palm, we already know that the palm having skin, and then under the skin we have deep fascia, that is palmar aponeurosis. It is thickened in the center side and going to form the palmar aponeurosis. Below the palmar aponeurosis we find this superficial palmar arch, and just deep to the superficial palmar arch we find the long flexor tendons which are going to reach up to the digits, and along with the long flexor tendons we have lumbricals, and deep to this long flexor tendons we have deep palmar arch also. But right now we are going to discuss regarding this superficial palmar arch. So the superficial palmar arch, it is mainly formed by the ulnar artery. So ulnar artery, as we know, this ulnar artery, it is going to pass superficial to the flexor retinaculum. As soon as it reach superficial to the flexor retinaculum and it reach up to the palmaris brevis muscle, which is situated on the hypothenar side. Just deep to that, this ulnar artery is going to divide into two branches, one superficial branch and one deep branch. So one superficial branch, it is a direct continuation of the ulnar artery, and it is the main artery to form the superficial palmar arch, while the deep branch, which is going to pass deeply, and it is going to form the deep palmar arch along with the radial artery, which we are going to discuss later on. Now this superficial palmar arch is going to be completed on the lateral side by the radial artery. So for that, let's have some basic information regarding the radial artery for making the superficial palmar arch. This radial artery, as we know, it reach up to the styloid process of the radius where we can feel the pulsation of the radial artery. Now before that, it gives one superficial branch. This superficial branch of the radial artery, it passes in front of the flexor retinaculum, while the continuation of the radial artery, it is actually the deep branch of the radial artery. It is going to wrap on the posterior side and reach up to the anatomical snuff box, and through the anatomical snuff box it is situated on the dorsum of the hand. Now from this anatomical snuff box, this deep branch of the radial artery, or it is a direct continuation of the radial artery after providing the superficial radial branch, it is going to reach into the palm through the first web space and passing through the first dorsal interossei muscle. So this radial artery, it is going to reach up to the palm between the two heads of the dorsal interossei muscle somewhere here. So here this dot, it is the part of the radial artery what we can see when we see from the front. So here this one is the radial artery, and this radial artery, it is going to pass on the back side through the anatomical snuff box, and after reaching up to the anatomical snuff box, it is going to come further forward in the palm by passing through the two heads of the first dorsal interossei muscle, while before that it gives one superficial branch which passes superficial to the flexor retinaculum, and this superficial branch, it is going to complete the superficial palmar arch by joining the lateral end of the superficial branch of the ulnar artery. So this arch is going to form. Now this deep branch of the radial artery, as it comes out from the first web space to reach up to the palm, it gives two branches. So one branch, it passes towards the thumb, and that branch, it is called as a arteria princeps pollicis. So as the name suggests, it is arteria princeps pollicis. So it is the main artery for the thumb, and this arteria princeps pollicis, as it reach up to the proximal phalanx of the thumb, it divides into two and going to supply the both the sides of the thumb. And another branch from this radial artery, deep branch of the radial artery, it is going to reach up to the lateral aspect of the index finger, and that branch, it is going to supply that lateral aspect of the index finger, and that branch is called as arteria radialis indicis. So arteria princeps pollicis and arteria radialis indicis both are the branches from the deep part of the radial artery, which they are going to supply the both the sides of thumb and the radial aspect of the index finger. Occasionally, from these two branches, they are also responsible for completing the superficial palmar arch. And sometime one more artery, which is actually the branch of the anterior interosseous artery, which is the main artery of the front of the forearm, that is running nearer to the median nerve and going to supply it, and that artery, it is called as the arteria nervi mediana. And this arteria nervi mediana, a branch of the anterior interosseous artery, it is also sometime responsible for completing the superficial palmar arch. So here this one is the arteria nervi mediana. So the superficial palmar arch is mainly formed by the superficial branch of the ulnar artery, while laterally it is going to be completed by mainly superficial branch of the radial artery, or occasionally by three arteries. One is the arteria princeps pollicis, one is arteria radialis indicis, or arteria nervi mediana. So this is superficial palmar arch formation. Now, which are the branches provided by the superficial palmar arch? This superficial palmar arch provides four main branches, and these branches, and out of these four branches, one branch is responsible for providing the arterial supply to the ulnar side of the little finger, and that is called as the proper palmar digital artery. While three more branches, they are going to be provided by the superficial palmar arch into the web space between the little and ring finger, between ring finger and middle finger, and between middle finger and index finger. So in these three web spaces, this superficial palmar arch is going to supply or going to provide three common palmar digital branches. So this is one common palmar digital branch, this is second one, and this one is the third one. And these common palmar digital branches, after reaching up to the web space, they are going to divide into two branches to supply the adjacent sides of the digits. So here this common palmar digital branch, it is going to supply the lateral aspect of little finger and this medial aspect of the ring finger. So like this. So ultimately, superficial palmar arch gives four main branches, one proper palmar digital branch and three common palmar digital branch. And this superficial palmar arch is going to supply all the digits except lateral aspect of the index finger and the whole thumb. Now, when we talk regarding the surface anatomical aspect of the superficial palmar arch, where actually it is situated, so it is situated slightly distally than that of the deep palmar arch. When we outstretch the thumb, the distal border of the thumb, it is correlated with the superficial palmar arch like that. And we will discuss regarding the deep palmar arch, and this deep palmar arch, it is situated at the proximal border of the outstretched thumb, so it is little proximal to the superficial palmar arch. So superficial palmar arch is slightly distal, and deep palmar arch, it is deeply situated and slightly proximal to the superficial palmar arch. So this is all about the superficial palmar arch.